Hi, my name is Jessica and I'm a chronic obstructive pulmonary disease expert. Can you tell me a little bit about yourself and what brings you in today?
Yo, what's up, Jessica? My name is Mike and I'm 49 years old. I've been smoking since I was 16. I was just diagnosed with chronic bronchitis and I want to know a little bit about the disease and what's going on inside my body.
Chronic bronchitis is a chronic obstructive pulmonary disease in which the mucous membrane of the bronchioles in the lungs become inflamed.
So why could a good guy like me get this disease?
Risk factors for chronic bronchitis include smoking or living with a smoker, hereditary deficiency of alpha-1 antitrypsin, and air pollution.
The main function of the respiratory system, which is controlled by the autonomic nervous system, is gas exchange. Air enters through the nose and mouth, then travels through the trachea and into the bronchi, which separate into each lung. These bronchi then divide into thousands of tiny branches known as bronchioles. At the end of the bronchioles, there are little air sacs called alveoli, which are wrapped with capillaries. This is the point of gas exchange. Bronchi are airways of the lungs that contain mucus and cilia. Mucus is produced in the mucosal layer of the trachea. The mucosal layer is made up of pseudostratified epithelium, which contains mucus-producing goblet cells. Mucus that is produced in the trachea lines the bronchial tubes. Cilia are hair-like projections that aid in movement of mucus and irritants. When irritants enter these airways, the mucus traps the irritants and expels them through smooth muscle contractions with the help of cilia. Gas exchange is essential to the body because oxygen plays a vital role in the breathing processes and in the metabolism of living organisms. Also, gas exchange allows for the removal of carbon dioxide, which helps maintain the acid-base balance in the blood.
So why am I coughing up mucus and I have some shortness of breath?
Symptoms for chronic bronchitis include coughing, which is caused by smooth muscle contractions. With the help of cilia, irritants trapped by excess mucus are expelled. Secondly, excess production of mucus or sputum, which is caused by an increased number of mucus-producing goblet cells due to irritants entering the bronchial tubes. And thirdly, shortness of breath, also known as hypoxia, is caused by the inflamed bronchial tubes as well as the increased secretion of mucus, thus preventing airflow from entering the lungs.
Patients with chronic bronchitis have irritated bronchial tubes, which become inflamed. Inflammation is caused by increased permeability of the cell membrane, allowing for movement of fluid from the extracellular fluid to the intracellular fluid. The overproduction of mucus is caused by the buildup of glands. This tissue change happens in order to produce enough mucus to keep up with the increased number of irritants entering the bronchial tubes. With an increased production of mucus, the airways continue to narrow, making breathing and gas exchange more difficult. Respiratory acidosis is an acid-base balance disturbance due to alveolar hypoventilation. The rapid production of CO2 and lack of ventilation immediately increases the partial pressure of arterial carbon dioxide, also known as hypercapnia. An increase in PaCO2 decreases bicarbonate, which decreases the pH. Hypoxia is where there is an insufficient amount of oxygen coming in and carbon dioxide going out. The three key concepts. The cell membrane is affected because the permeability of bronchial cell walls increases when they become exposed to irritants. This causes the bronchioles to swell due to fluid moving from the extracellular fluid to the intracellular fluid. Proteins. Protease enzymes are released in order to protect the lungs when irritants enter the bronchioles. Respiratory homeostasis is affected due to oxygen and carbon dioxide balance being disrupted. Oxygen has difficulty entering the alveoli, and carbon dioxide has difficulty leaving. This leads to respiratory acidosis, which occurs when the blood in the body has a pH of lower than 7.34.
Thanks for all your help. Now I know that chronic bronchitis is a narrowing of airways due to the inflammation and overproduction of mucus in my bronchioles.